How does gout inflammation impact your heart health? Have you ever wondered how gout inflammation can affect your heart health? Gout is more than just a painful condition that affects your joints. It is linked to a higher risk of heart disease and serious cardiovascular events. People with gout face a greater chance of experiencing heart attacks, strokes, heart failure, and even death from cardiovascular causes compared to those without this condition. Gout is caused by elevated levels of uric acid in the blood. This leads to the formation of needle-like crystals in your joints, causing acute inflammation, pain, swelling, and redness. However, this localized inflammation is part of a larger systemic inflammatory response that can negatively impact your heart health. Research indicates that individuals with gout have a 15 to 25% higher risk of developing cardiovascular disease. This includes conditions like coronary artery disease, heart attacks, strokes, and heart failure. For instance, studies show that gout patients have a 15% increased risk of dying from cardiovascular disease or having a heart attack or stroke. They also face a twofold increased risk of death from heart failure compared to those without gout. Interestingly, gout flare-ups can significantly heighten these risks. In fact, there is a fourfold increase in the likelihood of experiencing cardiovascular events such as heart attacks or strokes within 60 days following a gout flare. The connection between gout and heart disease is largely attributed to systemic inflammation. While gout primarily causes inflammation in the joints, the presence of urate crystals and the immune response they trigger can lead to widespread inflammation throughout the body. This systemic inflammation plays a role in atherosclerosis, which is the buildup of fatty plaques in the arteries. This condition narrows the arteries and increases the risk of blockages that can lead to heart attacks or strokes. Moreover, people with gout often share common risk factors with heart disease, such as kidney disease, diabetes, obesity, and high blood pressure. These overlapping factors can further elevate cardiovascular risk. In summary, gout inflammation impacts heart health by promoting systemic inflammation and accelerating atherosclerosis, increasing the risk of serious cardiovascular events. Effectively managing gout is crucial, as it involves controlling uric acid levels and inflammation. This is important not just for joint health but also for reducing cardiovascular risk. If you have gout, it is essential to work closely with healthcare professionals to address both gout and heart disease risk factors. Lifestyle changes and appropriate medical treatment can make a significant difference in your overall health.